How we all doing today? And happy Sunday. This is New Dawn TV International Limited, and we are on a show titled "You and Your Doctor." The purpose of this show is for us to have a time, some questions that is deep in our hearts that maybe because of our busy engagement, you are unable to go to the hospital, or you have been treating some things by yourself, unknowingly or intentionally. And
Self-medication.
we is a platform in which you have access to doctor for free. This is a very unique opportunity because if you are to go to the hospital, you have to take pay for consultation, pay for
Yes.
registration, and all that. So see this opportunity. So let's give a round of applause to New Dawn TV for giving us this platform. We have been having series of programs regarding this kind of thing. We have a lot of programs, back pain, nutrition, and some other things. So today is for children, and they say children are the heritage of the Lord, right?
Yeah.
And it's for mamas as well because
Yes.
they don't understand now. We need to understand for them. So, is there any pressing question in your mind? I'm telling you, this platform is the best platform to have because we have the best, one of
Have
the
the
best in
best in
town.
town.
Not only in town,
The
in
best
the
in town.
axis. So he has experience. Is an international doctor. Let me put it that way. Yes, we need to hype our our products. So,
Yes.
all right. We start
And
wasting
not
our
just
time.
that, he is a professor of pediatrics. A
Please let's
professor
celebrate.
of
Let's celebrate
pediatrics.
our
So
guests.
please just see this as an opportunity. Feel very free to ask your
Okay,
questions,
before we move
please.
further, my name is Mrs. Okpe Mikola Ole. I'm going to be a co-host for today, together with
Dr. Glory.
you are all welcome on. But for people that are watching us at home, this is New Dawn TV International. It's a media company where we help to promote content in terms of faith content that is biblical one, uh, in terms of educational content, health content, which is part of what we are doing today,
Yes.
entertainment and all that. And we have a lot of some of our services. We have a video recording, photography, online streaming. For example, you have a party, you have an event, and some of your people in other town they are unable to attend, and you want them to be watching the program exactly the time you are holding the program. Maybe you have a wedding party or something like that. So we can come to your wedding party. We'll stream it. People in Lagos can watch at the same time. They can join the wedding program at the same time. People in abroad they can join at the same time. That's what we call online streaming. Is as a token. And maybe you have a content you want to air. You have a business you want to advertise. We have our studio where we can give you slot for you to do it yourself, or we will help you do it at a token. You may not need those services, but if you have somebody that need the services, please always refer them to us. I think that would be the gift that you can give to New Dawn TV because we are giving you this for free, so we need something in return from you, and that is patronage. So this banner speaks a lot about what we do. At the end of the program, you can look at it so that you know more about our services. Thank you very much. So, it's now time. Dr.
It's
Glory,
about
can you
time.
do justice by introducing our guest?
Okay. Good evening
Because
once
you are a
again.
doctor, so I know you have the medical options
Okay.
to do
I've
that.
already said, yeah, the key thing is for us to know that we have a sound person in the house. We have not just a pediatrician, we have a professor in the house, and he's the CMD of Sweet Mother Hospital. And I am sure some of us here, yeah, so this is Professor Ibitoye in the house.
Please, let's make the round of
Please
applause.
just put
Let's
your hands
celebrate him.
together for him.
Thank you.
Yes, so
Uh,
this evening he will have some questions to answer for us to learn. And if you have your own questions, please can put them down. Sister, please just help them with the pen and the cards. Yes, if you have a question, please
So please wave your
write
hand.
it down.
You can get to paper
Don't
so
go
that
home with anything that has been
in your
in
mind.
your mind before now. Please, anything about your baby, please bring it out here. You know, feel free, because if you go to the teaching hospital to see him, I am not even sure you are going to see him. And if you go to Sweet
It's a
Mother
very
to
busy
see him,
person.
you're going to pay very well. So please,
See this
thank
as
you
an
very
opportunity.
much.
All right, before we
You're
move
highly
further,
welcome, sir.
because
Thank you.
Professor Ibitoye is an hot cake in town, and for us to get him sincerely, it's a grace, and we appreciate him. We did not take your coming for granted. And because he's doing this for us for free, I would like to give you a slot. We are also giving you a gift in return. Can you advertise your business on the show? Feel free to sell us anything about the business.
Thank you. I
And please
appreciate
feel
that.
free to patronize him as well.
Yes.
All right, you have the floor, sir.
I recommend him actually.
Thank you.
Okay.
Yeah.
So you have the floor.
Okay.
Tell us about Sweet Mother Hospital.
Of ourselves, we can do nothing really. I appreciate my host and co-host, and as well as appreciate everybody seated here. A tree does not make a forest, you know.
Yes, sir.
And I'm just happy to be here. I don't know if I want to really advertise the clinic because it's
I
actually.
want you to do so because I'm a marketer. So let me
Okay,
ignite you with
okay.
that.
I won't. Okay, Sweet Mother. The real name is.
Okay, let's do it this way. Let me interview you so that you will be able to give me what I
That,
want.
that's okay.
All right. So tell us about Sweet Mother. What inspired you in creating Sweet Mother?
Okay, let me start by saying that the real name is Sweet Mother Children's Hospital and Medical Center.
Is it only for children?
Well, the medical center answers that question because that means I also attend to general
Patients.
medical services. Okay, but specifically for children.
So what inspired you in creating
I
that?
think you should have asked what inspired me to be a pediatrician.
All right, sir.
You understand? Now, well, the truth is that not every pediatrician has a clinic. I appreciated my childhood, the input of my mother, the father. It could have also been labeled sweet parent, really. But you know, sweet mother, sweet father, up and down. But it's kind of remind me of what input my mother had in my
Where you are growing up.
in my growing up.
Yeah.
Even though I lost her when I was very young.
Oh,
Sorry.
so
But
sorry
that
about
was
that.
one of the reasons why I named this Sweet Mother. When I came to town, I didn't plan to stay in Sokoto. I came to Sokoto February 4th, 1998. And that was the first time I crossed the Niger. And I entered the town, it was like I won't spend the extra minutes. In fact, there were 6 of us from my class, and I was the least to stay back, counting this is 29th year.
Wow.
Yeah, I never planned to stay back, but you see, the way of the righteous man is ordered by God, really. I don't think I would have been able to achieve what I achieved if I've moved to my colleagues. I learned to wait on God because there were quite a number of other offers. I just settled and things started falling in places. Just grace, really. I didn't do anything extra. But you see, see that a man, you understand? Diligence.
His business.
Yes. Very important. If you have to do anything, do it the right
Well.
way. Now, I never planned to open the clinic really, but because my services in the clinic, in the hospital where I worked was very obvious, I learned to attend to people the way they should be attended to, help somebody who is in need, and it's like when I got to the hospital, when I got to Udut, a lot of people left, a lot of my colleagues left the place because, well, they were not just interested, they were just tired. I was doing everything together. So it got to a point where cars would be parking in front of my house, at least 10 in a day. They'll just come in, doctor, the child is sick, I'll see them, and then they go away. And it was becoming really stressful. So I now have to open my garage, and it was still coming in so much.
This is another business
You
clinic,
understand?
not more than
Something.
children. So you can pick.
You understand? So I didn't plan it
idea.
out, but God just allowed it to continue. In fact, if I wanted to enlarge it, I would have done that. What I felt, what I have present now, at least the aim is to be able to reach the people that cannot afford my services if I have to monetize it.
Okay.
If I have to go to Abuja to consult some of my friends' place, consultation is 20,000 naira. So if
Wow.
I see 5 in a day, I'm done. You understand? But in Udut and Sweet Mother, just for a token, really, so that at least a lot of children
People
can
can
be
be able to
attended to
afford it.
on a serious note. That's the only reason,
Okay,
nothing
so what
else.
are your services?
The services are purely for children,
Children's health.
all sort of children issue, both pediatric and child health, consultation, counseling, health education. Okay, I also see general medical practices, any that to do with general sickness. I
Okay.
don't do I don't do antenatal and I don't do delivery. Anything that is outside of that, I'm very okay. And where I'm a specialist pediatric nephrologist, I deal with kidney problem in children. You understand? So apart from being a specialist in pediatrics, I specialize in just that small aspect.
Okay.
So anything that has to do with kidney, both adult and children, I handle. Essentially, whatever can be handled in Sweet Mother, I refer to Udut, and if it's somewhere I can help them, I still follow them up to see that they get better attention.
Okay, thank you very much for that. So please, mothers in the house and father, all right, if you need a private clinic for your children, I think Sweet Mother will be the best to open a file instead of going to chemist and say my baby is having headache or something, because they don't have that specialization in children. They may help you, but they may not be the best in giving you the right medication. So please, I will advise us, and as you said, it's very affordable, so why can't we take the action today? All right, Dr. Glory, let's have the first question from you. Sorry.
Thank you very much, sir. And once again, we are glad to have you here.
The pleasure is
Sure.
mine, actually.
Okay, so here we are going straight into why we are here today. Okay, sir, can you talk to us on what are the everyday mistakes that parents make in taking care of their child or their children that causes the kids to fall ill often?
Okay, that's actually a very general question, but I'll
Yes.
try and take it from experiential um, viewpoint. Number one, by default, mothers are very caring. By default, majority of mothers will do everything to make sure the child is good,
It's healthy.
very healthy. They do that. The key, the first thing to do that mothers do wrongly is to start a baby on infant formula. That's
Infant
from
formula.
That's
from
food.
birth. Yes, the baby food, the NAN, the SMA, is no more trendy. There is nothing that can be made as close as breast milk. When your child is on breastfeeding, you almost don't have to worry about diarrhea disease. You don't have to worry about vomiting, and they're actually stronger and healthier. To be
Yes.
candid, the truth is that artificial milk-fed babies can be bigger, but it's just in size. When it comes to immunity, ability to withstand stress, the breastfed babies are better off.
Wow.
So the key issue is when you have babies or you have people who have children, they try the newborn, and it's like it's now trending. Everybody wants to carry baby food and give. No, it's not the best. When babies are breastfed, you can rest assured that if that child is passing diarrhea or watery stool, is what we call breastfeeding diarrhea. If the mother is not on any drug, because most of the drugs that the mothers take also can be excreted in the breast. So if you see a mother taking amoxil and is breastfeeding, the child can react to that amoxil sucked from the breast and start passing watery stool. The other issue that mothers do. What's the question again? Sorry.
Okay, what are the mistakes?
Okay, the mistake. Yes.
Yes.
The other mistake
That we
is the other mistake on a serious note that mothers make is to take children to chemists.
Self
Or on a
I think
serious
we're all
note.
guilty of
On,
that.
on a serious
self
note.
medication.
Now, you see, over the years, we realize that every time you go to see a chemist man, even a pharmacist, they are not trained to take care of children. Children are not young adults.
Ah.
So they say, okay, I give the adult one tablet, a child takes half a tablet. That is nothing is more wrong than that. And the issue is when you go to see a chemist man, all he's looking at is how much have I made today. That's the truth. So if you go to that chemist 10 times a day to buy a particular drug, they don't bother asking you who do you want to give it to. They give you, and then people waste a lot of money seeing a
They
chemist.
mix it for you.
They make a lot of money. They waste a lot of money seeing a chemist and delaying the effective treatment time. I've had to lose a lot of children just because of this. And by default too, we also need to appreciate that these chemist people themselves don't know what they are doing. Most of the time, it's just a business outfit.
Yes.
And what matters is the profit. Okay?
That
So
they are
you see,
looking
you see, a mother going to chemist because the child is passing watery stool, and all the chemist man does will be to give that child amoxil. Now, the major side effect of amoxil is diarrhea.
Diarrhea.
So a
Yes.
child that can be managed with just oral radiation, salt and zinc ends up becoming very weak and landing in the hospital. If care is not taken, that child will develop kidney problem because of dehydration. The other problem, the other issue, the other mistakes mothers make in this era. I mean, everybody now works. Both father and mother works. Where I've seen
Yeah.
cases, father is a banker, mother is a banker,
Oh.
and it's like nowhere to put the children. It's saddening to see a couple put a 2-year-old child in a school. You know, it's very wrong. In actual fact, the right age for school is 6.
Eh?
Wow.
In this Nigeria.
Wow.
Talk about preschool.
We learn every day.
Preschool,
Yeah.
preschool is 3 to 6. This is a critical time for them to develop ability to react and learn from their parents. The more you stay with them, the more they develop this ability to interact and relate properly. Okay, so you see somebody, a child is sick at 3 years, is in pre-nursery, and the mother still rush this child to school because he wants to do a test. The child is sick, quite okay. So I start asking them, is he going to write WAEC or JAM? Even if it's WAEC, your life is more important. You understand? So, and if you now look at what is on ground, when I was growing up, I literally raised my elder brother's children. Because, I mean, I finished school, I was at home, so I raised them, and they all turned out fine. I mean, but nowadays, which younger brother are you going to get to stay with these children? It can be very, that is the true life
very
story.
tasking now.
Very taxing. So, what do? You send them, and when they go to this crèche, they come across all sort of sicknesses, diarrhea, cough. In fact, the first day I got very annoyed in my life was when my daughter went to school, primary 1, and then she came back with one big coin on her head. That's the tinea capitis. I was mad because if you were to be in the house, I won't. But these are some of the things they catch when you send them too
Out
early,
too early.
too early on a serious
Okay,
note.
because of the level of their immunity.
Yes.
Apart from that, yeah, at that level, yeah, but after that age of 6, if you look closely, children hardly fall sick after the age of 6. You understand? Between birth and 6 years, that's when they keep going and coming, and they actually develop immunity. You understand? Now, it's very paramount for us to, imperative for us to realize that children are not young adults. So, very important. Once a child is sick, just try and see a doctor. I've seen a lot of children dying from this. I'm not happy about it. People trivialize when a child is sick. I always use one terrible word, and I'm sorry I'm going to say it. I'll tell you, children are crazy. Sorry about that. They are crazy that when they give you a long rope, okay, and you don't do anything with it, they hang themselves with it. And then when the wala has finally settled, it's your problem. They are gone. I can't bring them back. Okay, so when a child that used to run about before is sitting there in a place, you know there is problem. Whatever you are doing there, if you can't quickly prioritize that problem before you know it, you end up in the hospital. Now, every day I enter the hospital and I'm not happy because most of the sicknesses we see around are preventable.
Yes.
They are preventable. If you ever entered Udut A&E emergency, you will fear God. In fact, you start prioritizing. I think people should just learn to visit hospital from time to time and see what happens. The way we are now, we are at our best. If you have one terrible headache, okay, or you have one terrible stomach pain, you start rolling on the floor. So And this one I extend to adults. When you have a problem, even ordinary fever, don't just keep doing trial and error. Nowadays, people just drop dead anyhow. I saw him yesterday. What's happening? Ordinary malaria. It's not ordinary malaria. A lot of things have been
I've
going on.
started before then.
Okay.
Wow.
All right, thank you so
Prof.
much, sir. Um, the next question we'll be asking you, it's still regarding that breast milk. You know, there's this perception that bodies are not the same. Maybe
Sure.
some people, some women, when they give birth, the breast milk did not comfort
Sure.
like it is,
Sure.
or the breast milk is not enough for the child. Maybe the child eats sucked very well, and to save the child, they try to blend it with artificial food like naan or something, pig
Formula
milk
feed.
or
Formula
something like
feed.
that.
Yeah.
So,
milk.
in case, I know it's not the best, but in case of situation like that, what's your, as a professional, how can they regulate that? That's number one. Then number two, there is this saying that breast milk should be for the first 6 months without anything. But in situation like we in Sokoto, that the weather is hot and the
hot,
child,
dry.
our mothers will say, give the child water.
Little water.
So if go and buy ever water that is clean and
Yes.
something like that. So how do we blend that because of it and the climate, and we still want to fall in line with the right
Fall in line with
methodology?
exclusive breastfeeding.
It's okay. It's actually a practical question. Number one, if most people that have cesarean section delivery, because of pain, because of what they are going through, you see, the ability of the breast to let out milk is connected to the brain. If the woman is under stress, is in pain, the breast let out reflex will not work. So most of the time when these babies are born, in the first 1 or 2 weeks, their mothers or the parents are
Yes, trying to
are,
recover.
are, are expected to get artificial milk to feed them while the mother recovers. Now I have a saying personally, and I've seen it play out from time to time. One of our other mistake, sorry, I have to go back to the initial question,
Okay,
that
sir.
mothers make is to prioritize the health. This is going to shock people here. To prioritize the health of the child over themselves. Now, there is a saying in Yoruba land. I'm going to say it in Yoruba and then interpret. The Yorubas have a saying, "Tinoban joe, toban jo moe, tarenuma okogbo." If you are caught in a fire with your child, save yourself first.
So that you can be able to save the child.
It sounds wicked, but it's not. A lot of mothers have lost their life and left the children who eventually die because nobody was going to do the work of your mother. I've seen it played out several times. Okay? So I always tell mothers, you are the pot. The baby is the water. If you go to the riverside to fetch water, if the water pours away, your pot is intact, you can still go back and fetch. But once the pot is broken, no water, no pot. So mothers do die a lot, and on rare occasions we've seen mothers dying and leaving the children. Now the life of a newborn is so much attached to the mother being alive. In fact, more than 50% don't survive the first year of life. Okay, so if you're sick, take care of yourself, prioritize yourself. At worst, do it at the same time. Okay. Now, when it comes to the issue of breastfeeding, like I said, once a woman has, of course, we have mothers who have CS and are able to breastfeed right immediately. CS is not the same thing. Somebody had a CS, before you know it, 2 hours is up and about. We have different bodies. Whereas somebody up to 4 weeks, she's still trying to cope, and then CS could be simple or complicated. You understand? So in that situation, yes, you have to do something to protect the baby. Okay? And I've seen a mother of twins before who breastfed these twins without anything for 6 months. So when we have multiple gestation, 2 or 3, then at that point in time it's going to be difficult for the mother to go exclusive. Okay? At times we encourage them first 2 months, 3 months thereafter. It's obvious the babies are even losing weight, because that's the most objective criteria for asking mothers to start artificial milk.
food.
Now, the 6 months is what we tell people generally, but scientifically it's been proven that at times by age of 4, some children can no longer grow well on baby food. In that case,
At 4 months.
at 4 months. So in that case, it's allowed to start. Once
Artificial.
in those days when we were trained, every time you bring your child to the hospital, we do what we call growth monitoring.
Okay.
So you see this child that is faltering to grow very well on exclusive. In that case, it's an objective reason to say, madam, it's like the breast is not enough. Try
For
and
the child.
complement it. Okay. Apart from that, there is no other reason.
Then about the issue of water. When should
Yes.
we introduce water? In
Yes.
the hot
Now, the
season?
truth about it, when we talk breastfeeding, exclusive, no water. Okay, exclusive means no water, but the child can still take drugs. If the child is sick, you have to give out malaria paracetamol.
Yes.
That doesn't affect. Okay, so the point here is when it comes to that issue of water, Sokoto weather is very hot.
Yes, okay.
Okay, very, very hot. But you also need to appreciate one thing. It is now the motivation of the mother that can keep her from giving, because the breast itself is 95, 96% water. So if the mother is well hydrated and is not a market woman who is always running about, is even forgetting to drink water, because if the woman is dehydrated, you can't produce enough. So we always advise mother, when you are breastfeeding, take
Drink
enough
enough
water,
water.
take anything watery, pap, custard, tea.
So it will serve as water
drinks.
for the baby.
No. As mother is taking, the mother is well hydrated. The hydration will allow mother to produce
More
more
breast milk.
milk. You understand? That's the issue.
But there is this ideology that our parents, they'll say the child is thirsty.
That, of course, scientifically is not true. I've had to handle this from time. It's not true. If the mother can, you see, we have some well-motivated mothers. Of course, a lot of factors come in. Okay, is it getting 3 square meal? Is the house conducive? If there's no power supply, like so, the weather is hot, is there a standby gen or a solar? Even without that, some people are just naturally motivated to take care of their children. But when you are a little bothered at, okay, this place is hot, there's no power supply, it's also going to go to the brain and affect breast-let reflex. In that case, we need to produce. But once you are well motivated and you know the importance of it to your child, it shouldn't be so difficult. Now, I must also appreciate the fact that Sokoto weather is extremely hot. You understand? Now, where we tell people take 3 liters in a day, during the hot Sokoto weather, you may need to go as far as 4, 5, 6 liters, because even staying outside is enough to make you feel dehydrated, and this has serious impact on the mother's ability to breastfeed. You understand? So it is not true, even in this weather, just breast milk enough, where the mother is well hydrated, well fed, well motivated, can take care of the baby without adding water.
Okay,
Now, let me quickly add. When a child is just on breastfeeding and is passing diarrhea, we look at the child, nothing worrying. We tell you this is breastfeeding diarrhea. There's a diarrhea called breastfeeding diarrhea. You don't need to do anything. Just tell the mother, continue breastfeeding, it will stop by itself. But once you had any other thing, apart from water or artificial milk, in fact, most of the time, artificial milk will make them stew. When they come to my
So
clinic,
if
I
you
tell
are
them
doing exclusive and the baby is stooling, it's
and you are
normal
sure there's no other problem,
that you
it's
added
normal,
for the baby.
very normal, and that you are not on a drug that can trigger diarrhea, because most of these drugs, even
That's their side
the
effect.
amoxil, the side effect is stooling. You understand? So some children, once they suck such a breast milk that has amoxil inside, it can also be stooling. But that shouldn't be a problem. Once you give them more breastfeeding, they get better.
All right. While we are moving to the next segment, which is on questions on growth and development. If you have any question, please see our sister. Can you raise up your hand? You can get your sticky note and write it down and pass it back to us so that we will do it in an organized way. See this platform as a free platform to ask your question. And this is New Dawn TV International. If you are just joining us, it's a media company where we air content related to faith, education, religions, and entertainment. So feel free to join us every time on our Facebook platform, New Dawn TV International, and on YouTube, New Dawn TV International. And we are on the show, You and Your Doctor, with Professor Ibitoye. Over to you, Dr. Glory.
Thank you. Oh, thank you, Prof, for that. That was an extensive one. So I would like you to tell us what are the growth milestones that parents should check for in the first 12 12 months. Yes.
of the
It's
child.
okay.
Yeah.
Thank you
What
so
are
much.
and when can a parent get worried that a child is not talking, not working? Yes.
Okay, let me approach it from this angle. Um, One of the milestones in child development is crawling, but crawling is optional. So you see a child that is sitting, is not crawling, that child will just wake up one day and start
Start
standing
working.
and start walking. So crawling is optional in children, okay? But normally, if a child cannot control the neck within 3 months of life, it's a red flag, okay?
3 months.
Usually, you see, until you lose the ability to control the muscle of the neck, that's when you know that this our head is heavy. It's actually heavy. So as they grow, they are able to get energy into those muscles and then they can hold the neck. Latest by 3 months, they should be able to control the neck. Once you carry a child up, you still have to support the head from the back after 3 months. It could mean a red flag. Okay? And of course, I always tell people we are like this, we are fingers. That's the general. Some children may wait till 4 months before they start controlling. Doesn't mean they have problem. Okay? Whereas my first daughter walked at 8 months, my last one didn't walk until 1.5 years.
Wow.
The same father, same mother. Okay? And whereas the first one also talked very clearly by 10 months, Jemima, Ella did not talk until 1.5 years, probably past 1.5 years. It's a whole range. Okay?
Yes.
So if a child is not controlling leg by 3 months, you should see a doctor. Not panicking, find out what happened.
What is happening?
Okay? Exactly.
Yes.
So we should not ask ourselves the question, but rather the person that will give us the right
Yes.
answer.
Exactly. Okay?
See the doctor
Then if a child is not sitting by six months,
by 6 months.
it's also a problem. It could also signify a problem. Okay? Normally a child should crawl by 7 to 8. But some of them may not even crawl. They just keep
Jump,
sitting
walking.
without moving at all. All of a sudden you just see them standing and they start walking. That's also possible. So if a child doesn't walk by 1.5 years, it's a problem. Some people have this habit of trying to make a child stand at 6 months. It's not necessary. Okay?
But
It's
is
not
there any
necessary.
measure one can put when you are seeing this red flag, maybe naturally, to help the child?
Now, when it comes to the issue of standing and walking, you can get a walker. But when a child doesn't sit at 6 months, what do you get? A sitter? You don't get a sitter. So once the neck is not standing by
Balanced.
3 months or sitting by 6 months, you should see a doctor. And to be candid, we have Udut is still very, very approach to most people, even though people are not used to waiting. That's the issue. You have to see Udut as a general hospital. A lot of people are coming in, the doctors are few, a lot of them have traveled out. So you have to wait. At times you come to, they give you 3 months appointment. Look at it, it's not an emergency. If you can't wait, go private. But a serious, when you see any of these red flags, the right thing is to see a doctor. Any general doctor can do something. But if that general doctor cannot really find out what the problem is,
You have
then
to
they
be
will
a
refer you to a
specialist.
pediatrician who will look at it and know what to do. Okay? Now, the other issue has to do with feeding. The issue again, it's always surfacing and resurfacing. A child at 6 months or even at 1 year, 6 months, refuse to eat any other thing apart from breast. Some children are like that. Okay? Whereas we have children who just stop breastfeeding on their own as early as 6 months. So we have some who will not leave breast until they are 2 years.
2 years plus.
Yes. And when you try to force them to stop, some of them end up in noodles with serious malnutrition, and we eventually lose some of them. I'm serious. Some children are just naturally stubborn. They won't take anything. If you like, go and put bitter leaf and rub everything. they will still suck it and continue. They are just they are just being themselves. Just like I said, every time I see them, they are like this. Whereas, like I said, my Jeremiah was eating every other thing by 8 months, working by 8 months. Ella did not eat any other thing until after 1 year. You understand?
So that's the whole
They could
work.
be like that.
So can the milk serve her till that
No,
1 year?
no. Now,
Okay,
the
so
point here is that
how-
they will still be taking Cerelac, but they will refuse to stop the breast.
Other
Okay.
food.
And when you stop them from taking the breast, they stop taking the complementary feeds. And then because you look at the child, he's not taking water because you stop the breast, he's not taking food, and then they end up in the hospital with serious problem. It can be that bad. It can be that bad. I've seen cases before, and we have lost quite a number of them. Except by the time they are coming, usually it's always too late.
Too late.
So to bring them back again is you just try what we are able to salvage some end up.
Okay. Thank you so much,
So
Professor.
sorry, and that brings me to what I always tell people: if you compare a child with another one, you kill one. Don't compare them.
Don't compare children.
Don't compare them.
All right, I think we are getting a lot of insights and knowledge with what we have been discussing so far. So we have one more question from our side, and we'll give a room for the audience to ask their question. So, sir, there is this normal sickness, like popular one, like malaria, cough, and catarrh. And as parents, we feel that I can just go to the chemist. I know the drug for catarrh. I know the drugs for cough syrup and all that. So, when is it safe to treat at home? And when is there a red flag to rush the child to the hospital when we have malaria, cough, and catarrh?
Okay, thank you very much. It's also a very practical question.
Yes.
Now, it's not all sicknesses you take to the hospital, really.
Yes.
Unlike
Thank you
here,
for
I
that.
was privileged to travel outside the country. I was in Cincinnati, where I went for training, and I was there for 6 months. By the time you see an Oyibo child coming to the hospital, it's a very serious issue. They hardly fall sick, unlike what we have here. In fact, if malaria is out of our problem in Nigeria, most of the doctors will not have anything to do. Malaria kills more than half of our children. So, when you say a child has fever, it doesn't mean the child has malaria. Malaria is the commonest cause of fever. So that fever you are saying could be due to pneumonia, could be due to
So having hot body
is not always malaria. That's the mistake people make.
There are lots of
You understand? A lot, more than 1,000
yes.
causes of fever in children, but the commonest cause is malaria. Okay, and it's allowed for you to try to attempt to treat. Most of the drugs we use in the houses are what we call over-the-counter drugs.
Okay.
Okay, if I have to sit down and treat malaria in all children in Sokoto, I will probably die from exhaustion. Seriously. Okay, but malaria is no more what we used to call it. We now have differentiation.
Okay.
We have simple malaria and we have severe malaria. When you say somebody died of malaria, don't think it's simple malaria. It's complicated malaria. There are a lot of criteria. But one thing you must look out for, if a child has fever, the first thing you want to do is give paracetamol. It's allowed. Bring down that fever. If within 30 minutes, 1 hour, the fever is not coming down, use warm water on the body, not cold water. If you use cold water, I can make warm water, not cold water. We call it tepid
Mind
sponge.
Yes.
Okay?
It's fine.
If you use cold water, that child can develop
Shiver.
internal heat more and then start convulsing. The major complication of fever in children is convulsion. And when the child convulses, we as doctors are worried about their brain. Because once the brain is gone, the man is finished.
It's gone.
Okay? So if that child had fever, had had convulsion before, and is running fever again, once you give paracetamol, 30 minutes is not getting better, either you put towel in warm water or just pour the water on in warm water and allow the water to dry off the body.
Right.
That process of drying off the body will take away the heat, and you have to do it several times. Now, if within a day the fever is still persisting despite starting a drug and it's still coming back, if you listen to paracetamol jingle, they said after 2 days we are not better, see a doctor. That's for adults. For children, if within a day the fever is not settling and the child is not better, don't wait until the child starts convulsing. You understand? Very important. Once the child has fever, even in the middle of the night, give paracetamol. Within 1 hour it's not getting better, use warm water on the body. As soon as possible, take that child to the hospital. Now,
Okay.
there is this funny belief that there are no doctors in hospitals in the night. In fact, the best time to go to hospital is night, because when the night falls, it helps us separate those who are really serious from those who are not serious. When you see somebody driving to the hospital 3 a.m., it's a serious issue. You understand? So if anytime your child is sick with fever, in fact, I always mention some red flags. If a child is becoming very weak, you notice in the middle of the night, don't wait till the morning. Very weak child, don't wait. If the child is vomiting persistently, that is 3 or 4 times, children can be very, very annoying. Once they start vomiting, they become very weak.
Yeah.
That weakness
And reduce
is
insects.
a terrible problem. It can turn out to be a terrible problem. Don't wait till morning. Don't say, I want to go and see professor. 3 a.m., start going to Udu. People always look at their conveniences, whereas when the wahala starts, you will forget, even your name, you forget it. Don't wait till then. You forget everything. We work because of children. You understand? Yeah, there could be a place where you've been tired and then it's like happening at night. If you have a car, just enter the car and go to the hospital before they start blaming you. You understand? So, if a child is running fever, I give paracetamol. And then, if you have what it takes, you can go to the chemist and buy drug. There are standard drugs for malaria. The problem with those anti-malaria drugs is that we don't know how to use them. You see somebody who is taking anti-malaria and then they are using juice to administer it. It won't work. Once a child is on oral anti-malaria, no juice, no fruits, no vitamin C,
But
no
what if the
multivit.
child is the one that don't like drug and will vomit?
If he's vomiting, then you put on injection. That's where injection comes in.
Some
You
child
understand?
reacts to
Of,
drugs.
I know some children, you give them 10 times drug, 10 times they vomit it. They are just like, whereas some children, before you bring it up, they have collected it and taken. You understand? So that's where the issue is. So once you notice that the child is running fever and is not getting better, take him to the hospital. But if you have what it takes, if you, of course, there are good hospital, there are good pharmacies in town. Okay, some of these drugs can still be dispensed. Okay, you think it's malaria? Okay, let's treat malaria first. If it's not getting better, go and see a doctor. Okay, when it comes to the issue of cough and
Cough,
catarrh,
yes.
the major problem with cough is once a child is coughing, pneumonia is around the corner. One of the key signs of pneumonia is coughing, but it's not just ordinary cough. You start knowing that the child is breathing very fast, and that's an issue. Once the child is breathing very fast, they are struggling to breathe. Funny about children, especially when they are less than 2 years, once they keep struggling, you don't do anything, they get tired and stop. That's where the problem is. They get tired and stop, and it will be too late by the time you get to the hospital. So when you see such a thing, those children may need oxygen because already they are struggling to breathe.
Stressed.
Now, the issue of catarrh is also related to pneumonia because most of the time, pneumonia doesn't just start like that. It starts with what we call upper respiratory tract infection. If it's not properly managed, it can now spread down to involve the lungs. Okay? The major problem with catarrh is at times it blocks their nose. Most children are obligatory nose breathers. Once the nose are blocked, they can't sleep and they don't know how to use mouth to breathe. In that case, you have to either help them suck it out. You don't use mouth to suck it out. It doesn't work that way. We have suckers that I can buy in pharmacies.
And
Just put it and
we
suck it
used
out.
to make that mistake.
You understand? It helps a lot. Okay?
We
And
use
there
the
are
mouth.
other drugs too that can be used. But don't put your mouth and suck out
Catarrh.
catarrh because the anatomy of that place is not what you think. Okay? They are connected the other way around. So in attempt to suck, you push it inside. It's going to be a problem. Okay? So don't do that.
All right. So questions, please. Can you help us pass the questions? Do we have some? Yes, yes. So this one we are going to do. Dr. Glory, you take care of the written one. Then, if you really want to act verbally, you can raise up your hand. You can give you the mic to act by yourself. So let's deal with this first.
So I think we can start with this. This question says, please sir, is there anything to panic about when an 8-month-old baby is teething but having temperature, and checkup says there is no malaria, but child is sucking properly and showing willingness in eating.
Okay. I think it's also something we should talk about. There are a lot of
Teething.
misconceptions about teething in children. God will not give children teeth and make it to suffer them. No. Okay, but there are standard symptoms we see with teething. At times they become irritable. They start drooling saliva because as the teeth is coming out of the gum, it's itchy. So they pick this, put it, pick that, put it. In doing that, they get contaminated. They start stooling. They said it's teething diarrhea. It's not true. Abroad, there's not like teething diarrhea abroad because their environment is very clean. They don't have that problem. But well, for us here, our environment is so dirty. Since we don't have what we call, there are toys we call teethers. Teethers are supposed to help them massage their gum. They keep scratching it and then it's clean. Once it's dirty, you remove, you give another one. How many mothers have that time? You understand? So once the teeth is coming out, they can have slight fever, slight. Once you touch a child's body and it's very hot, it's not teething. There is a particular episode that keeps playing in my mind when I started training. There was this woman, a Yoruba woman that was coming into Udut. I was just leaving the hospital around 9 o'clock. The woman was shouting from the gate. They said his teeth to. By the time the woman get to the ward, the child was dead already. Now what happened? The child has been stooling and his neighbor said, "Don't worry, he's teething, he will be fine." The child got dehydrated. He's also running fever. Okay, and she didn't do anything. By the time the child now stopped, she was trekking down. Already it was late. So there's nothing like teething diarrhea, truly. But they get contaminated because they put, at that age, everything is to the mouth. And since everything around them is contaminated, they get diarrhea. The major problem with diarrhea is loss of body water. Children get easily weak once they lose body water.
Sorry, please, I want to chip in a question. There is this thing that they said if a child is stooling, you should not stop it. And yes, there is this that it's not good to stop a child stooling or something, but it used to make them weak and reducing.
Okay, fine. It's a good question. There is people want to look for shortcuts. The best thing to do managing a diarrhea is to replace what is being lost, and that's ORS. They have another thing now that we call zinc. Once you put them on ORS, what they are losing is not just ordinary water. There are also other chemicals inside, electrolytes. Okay, so if you just give them water, they can still have problem. If you stop now, stopping their stooling is not okay because what they use, miscaolin, okay, it can cause block because their intestine is very narrow. If they take too much, it can become solidified inside the intestine and cause obstruction. It has happened before. So the rule is don't stop a child when he's stooling, especially when they are less than 6 years. Okay, what to do is give them extra water. If you won't take, there are some children, if you mix ORS with them, they won't take it. In that case, if they are still breastfeeding, continue to breastfeed and put them on zinc tablets. Zinc has a way of repairing the lining of the intestine.
How do we do the zinc? What's the dosage?
The zinc is a standard, just 1 tablet per day. It's a standard
Then some
tablet.
people say you can put it in Sprite. It's okay, right?
In Sprite, the zinc,
Yes.
why put it in? So I just need 5 mils of water. You understand? Yes, there is a concept where people can also use Sprite to hydrate, but it's not good for young children. Okay, people tend to do that when they are getting frustrated. But the right thing, which people don't like to hear, is that once a child doesn't take anything and is stooling, that child needs to be admitted and placed on drip. Just that 1 or 2 days of stress will save you lifetime of regrets.
Thank you, sir. This second question is still on teething, so I think I will just read it. So, okay, this person said, for how long can a child have teething problem? One, when a child is having teething problem and the child is taking teething medicine,
Like,
Mona baby.
like
it's okay,
which
so
one?
we'll
Okay.
get there. We'll get there.
But the child is still vomiting and not eating food after taking all the drugs. and the child is still vomiting, what can the mother do?
Okay. Thank you for this question. It's a very practical question. Now, really, teething doesn't cause vomiting. It doesn't. Teething doesn't cause vomiting. Most of the drugs they call teething drugs are really not teething drugs. Take for example your pecan. At a point in time, pecan was being sold at 16,000 naira for a
Yes.
bottle, and
Yes.
I see it as sheer wickedness. And the mothers will hold the father by neck. If you don't buy it, you will eat in the house. They will hold the mother. In fact, if the man wants to sleep, you have to go and get it. But it's really wicked because the pecan is so expensive because it's imported. It's nothing different from your Bonababe or Fluge or Nice Plus. They contain paracetamol and Piriton. Even the Piriton side is so small. Why they added those things? Because it is known that teething can cause slight fever. Slight fever. Okay? Then the Piriton is supposed to help calm them down because they get irritable. It makes them a little sleepy. And then Piriton also has this small effect in vomiting, against vomiting. You understand? So instead of wasting so much money, yeah, that's the nausea. Okay? Now, instead of wasting so much money on, just buy paracetamol. Once the child runs fever, it's standard. It's not so hot. Just touch body is warmer than. But once you touch body, it's like it's burning. That's not teething. In that case, you need to take care of that child and see a doctor. But if it's just light, have you not seen children? You just wake up one day and it's find 4 teeth in the mouth, no complaint, nothing, nothing. Some children, 2 weeks before the teeth come out, they are putting you in all sort of. It's the same thing like saying they are like this. You wake up one day, just find 8 teeth in their mouth. No, no wala. So if you have it like that, you will know that it does come problem. But the one that will give you up to 2 weeks is doing practical. Okay, is shouting, is not sleeping, is not sucking, it's stooling. All those ones are the ones that you need to pay attention to. And like I said, if you have not had anything, it's because once the child is stooling, what you need to do is give ORS, okay, and give zinc tablet. If within a day or two the child is not better, see a doctor. Some of them will not take the ORS, don't force them. You give them 10 times, 10 times they vomit it. The more they vomit, the more they get
lose
weak.
weight.
Right, thank you, Prof. Thank you very much. This is a question on breastfeeding, and I think the first question has been answered, but I will still read it regardless.
That's okay.
It says, what are the effects of breastfeeding on a child's growth? That's the first one. And the second one says, when a child doesn't suck breast milk at all from birth, does it affect the growth of the child? Does it affect the overall functioning of that child?
Okay, I'll take it from the second one.
Yes,
It really
yes.
doesn't. We have babies that are just placed on artificial milk and they are doing well. Where breast milk comes in is that breast milk is packaged by God, everything intact.
It's inside.
Okay, now there have been this misconception, especially from our brethren from the east. When a child is having problem, they collect the mother's breast milk and put an ant inside. They say if the ant dies, that means the breast milk is poisonous. I mean, how can you put ant inside water and expect it to survive? You understand? And the same people said that I read a lot of literature when I was growing up. There was this particular an Igbo saying that says that a child's sperm cannot be scalded by a piece of yam given to that child by the mother, because mother will have checked the temperature before giving the child. You understand? That is practical. So God will not give any mother a breast milk that will kill the child.
Yes.
It's a perfect food. Everything is intact. Have you ever seen a completely breastfed baby? 6 months is looking chubby, is big, no problem. You know, exactly. They are doing well. Okay, unlike having to buy baby food, and then when you buy the baby food we are using, are actually terribly.
And they're not even
They are
expensive.
terribly.
They are too
They are,
expensive.
it is actually the focus of baby food is just to supply calorie and protein, but they have a lot of foreign antigen that can stimulate a lot of problem in the children, inflammatory reactions, and commonly they cause diarrhea. Apart from the costs, Okay, if you have the breast milk, give this baby. It puts your mind at rest. If the child is stooling, you know I don't have any problem. And babies that are breastfed had more immunity than babies that are given artificial milk, because in the first few days of life, we have what we call colostrum. That colostrum is packed with a lot of immune modulant material that can never find any other place in the world. So if you deny that child that particular stimulation, usually they tend to fall sick frequently, which is not ideal. Okay, the other question says,
I think you have answered.
Say, does it affect the overall
exactly.
functioning
Okay,
of the
I've mentioned
child?
that in passing.
Yes,
It doesn't.
yes.
If you look closely, really, most artificially fed babies are bigger, but it's just in size. When it comes to ability to withstand stress, they don't have it. Scientifically, okay, it's like giving me meat pie morning, afternoon, night. A lot of calorie inside, but it's going to a lot of hair, coke every now and then. You get bigger, but immunity is almost zero. Okay.
All right. Thank you, Prof. And this is our last question, except if there is any other.
Okay. Then
From
we
the
still have
audience.
one more
They
question.
said,
there.
please, sir, why does it take a breastfeeding child 1 week before stooling? And is it advisable for me to give the child orange just to ease the stool?
Okay, that's also a very practical question.
Yes.
Now, that means the truth of the matter is that babies that are breastfed tend to pass two more than babies that are artificially fed. We call it breastfeeding diarrhea. It's always loose. They call it a goosey like stool. When they get enough, they pass more stool than babies that are artificially fed. So if that child is not passing stool well, it's because he's not getting enough. So the baby takes what you give and convert it without having anything to.
But is it like watery or normal one?
Normal baby stool is loose. I won't call it watery.
Yeah, but
Okay.
when it is watery, that's when there is a red flag.
Yes, what even loose stool also can be a red flag. Now what when diarrhea comes into play is the how much, the quantity, not the frequency.
Okay.
You have a child passing stool small frequently and is doing well. We have someone just passing one and is very weak.
But, sir, can I ask this?
Yes,
Is
go
there
ahead.
any stage at all that they pass to like once a week and it is okay? Because I had the time that my son was passing to once a week, once in 8 days, once in 10 days. And I talked to a senior doctor and she said, yeah, that it is okay for that time. So
Now let's look at it from here. Everything in life is in range. Some children passes to 3-4 times a
Very
day. That's their own.
okay.
3-4 times. Whereas another one passes once in 3 or 4 days. That's the normal range.
Okay.
Sorry, I'm going to shift into scientific. Say there's this thing we call Gaussian curve. In Gaussian curve, not everybody under the curve is normal, and not everybody outside the curve is abnormal. That's Gaussian curve.
Yes.
So the point here is that, like I said, they are like this.
Yes.
If you've looked at the pattern of the child, if the child is passing after 7-8 days and the stool is not very hard and is passing it normally, that's his own pattern. But once you pass the stool after 5 days and it's very hard, that means that child is constipated. You understand? So you have a child that passes stool normally 4 times a day on breast milk or normally, okay, whereas some of them once in 5 days, but the stool is not hard, just normal loose stool. That's their own system. But when you have a breastfed baby who passes stool once in 7 or 8 days and the stool is very hard, okay, it shows it's not getting enough.
Okay. Okay. Thank you, Prof. I have a question on colic. This from week 3, I think, week 2, 3, for some, they say that the child is having pains in the abdomen, that the intestine is unwinding, and some will give grip,
Gripe
Yes,
water.
gripe
water.
Gripe water.
gripe water.
Gripe water.
Some give any other thing, What can you tell us
Okay,
about that?
I will have been very, very sad if I didn't mention this. There is nothing like abdominal pain in children, really. Now, you see, um, all those things they talked about, um, I think the gripe water, there's another one they use, what's the name? Colipan,
Colipan. Okay.
nospamin. All those things contain antispasmodic. They
Okay.
don't have. Now, you want to find out if a child, are you sure this child is having stomach pain? A child cries when they are hungry,
Yeah.
when they want to be carried,
Yes.
when they want to sleep,
Yes.
and when their diaper is wet. Now people come and say, but the stomach is making noise. Every time your stomach make or your abdomen makes noise, does it mean that you're having pain? Most of the time they are taking something watery. How can you flush a toilet? You don't expect it to make noise. As what they eat is passing through, it makes noise, but it's not painful. Okay. Now we also need to appreciate one thing. The process of using the convenience is learned over time. Some of these children, some of them will do it naturally, some have problem mastering it. It's like wants to sleep and the poo poo is coming out. It's inconvenient, so they will scream. It doesn't mean they have. Now whatever will make a child develop pain, most of the time they will need surgery. Either the stomach is distended or it's not passing stool or the stool is very hard. But this issue of colipan, nospamin, there is no place for it. None.
Wow.
None.
Thank you.
I've never prescribed it for a child.
Any
Since
child.
no, I don't. You just need to. At times you need a lot of. There are a lot of misconceptions about some of these things, and there are people. Some people I call them yard doctors. They are even more dangerous than non-medical people. They talk as if they know what they are saying because they've done it for their own children. Whereas when they are just forcing it. You understand? If you don't give, I didn't give any of my children colipan or nospamin, and they turn out very okay. You understand? But when you see a child that's really in pain, that child cannot be consoled, and then most of the time they end up on the theater table for operation.
Thank you, Prof. Thank you for that clarity. And this one last one here. Say, sir, please can we use ORS for a child that is having constant vomiting before taking the child to the hospital? Then secondly said, why on exclusive can a child be given water, and can we still say that it is exclusive when you are giving water?
Okay, I think we've addressed that.
Yes.
Number one, the issue of
ORS.
ORS.
Yeah.
It's very simple. If a child is vomiting, you can't give anything by mouth. Most of the time they won't take it. Once it goes in, it keeps coming out. And the more you attempt to force, the more the vomiting, the more the problem. So once the child is vomiting, is no.
The hospital.
Okay? Vomiting is very difficult to manage than diarrhea.
Yes.
Because whatever goes in will always come out. Unlike diarrhea, where if they are taken orally, you can replace. In fact, one of the reasons why you shouldn't keep a child who is vomiting at home is if it's also passing diarrhea. That means they are losing it double way. So you can't manage properly at home. Don't keep that child, especially when they are less than 3 years. Don't keep them at home because they get easily hydrated. And once they don't have enough water, the kidney just shut down. Kidney failure.
Correct. Do you have the? Have you read the last question,
Yes,
or shall I
can
read
we
from
still
here?
say that it is exclusive when
You are
Exactly.
giving water.
and you are still giving
No,
water?
it's not exclusive.
It's not exclusive.
Really, it's not. You see,
Yeah, it's
let's
diluted.
let's face the fact. Let's face the fact. Let's face the fact. The point here is the breast milk itself is 98% water. The problem I see in most of our mothers is that they are not patient enough. They have their hands in so many things. They don't have that dedications the older ones had. That's the issue. And then this Gen Z issue of work. I mean, you see a woman at work from 8 coming in. I don't know. I have a lot of younger ones in Lagos. They leave their house as early as 4:30. They can't come back until 9:30 in the night.
Very true.
But fortunately now, it's like the government has increased maternity leave to 6 months. Even the fathers now has 1 month. It's in an attempt to make sure.
I just
You
pray they
understand?
will be able to use the 1 month.
That's the problem.
Now I can have 6 months.
Yes, 6 months. At least in my department, is already taken off. 6 months. In fact, some of us are even thinking of having a baby so I can have, we can have 1 month free with paid, all expenses paid, you know. So, and these are ways government has been trying to, even they are trying to enforce also on private private companies. But you know our mothers, when you give them that 6 months, they used to do something else.
Yes, we still have question.
That's when they will not, they want to
No,
improve
you
in their
have to do
business,
remotely.
and it's
All
supposed to
right.
be used purely for that.
Okay, we have somebody that wants to ask for about him, right? Okay, can you give her the mic?
Okay.
All right, you want to ask for him, sir?
Good evening, sir.
Thank you. Good evening.
My name is Obianke Confidence, and I work at Oncology Clinic, Onco Clinics to be precise, in Udut at the Oncology Ward. I have a question that has been troubling me, particularly for children. They bring so many children from the pediatrics to come and do CT scan, and sometimes to come and do cancer radiotherapy treatment. What is the cause of tumor in children? Is it children of 4 months, 5 months, 6 months?
In fact, some children are born with cancer.
Ah, it's
Is it
heartbreaking,
inherited?
and I've
Is that
been wondering.
Inherited, right?
It's not.
It's so heartbreaking, and I've been wondering: is it that the mothers were not taking their pre-vitamins? Is it because most of the time we lost these children?
Yeah.
I lost one.
You
the
you you want to sell a freezer to an Eskimo. This is what I do every day. I see it every day. Now, let me quickly address that. You see, the problem in the north is negligence. Negligence. You see a child with a big tumor in the eyes, and it's been there all along. First of all, they will go to the village and get somebody to puncture it with hot iron. Okay? I mean, this thing has been there. You see a child that has a white flicker in the eyes, and you feel it's normal. But if they had come, that's retinoblastoma. If they had come at that time, it can be properly taken care of. They don't come until, you understand, that has been our problem in the north. In the south, when you see such a thing, people quickly go to the hospital. And of course, don't let us forget, the north is the headquarter of poverty. It's really, if I have to leave Udut today, it's because I've had it up to this point. I've spent, to God be the glory, I have to, in pediatrics, we contribute money to take care of these children, and we still eventually lose them. So we have talked, let the government enter into, what you see in Udut is just 1 out of 10. For everyone that comes to Udut, 9 are dying in the villages. For everyone you see. So imagine if you have to now go to the village to, you almost die of depression. Some of us have developed, in fact it's God for some of us. Because you see children die, slip into your hand for what can be, all those cancer you are seeing are all treatable if they are presented early. Most of the time they come at stage 3, stage 4. What can you do? I believe in miracle, but I think God is not ready to do that kind of miracle now. No, it's really unfortunate. It's not as if it started just like that. It's been there. The truth is that, I'm talking from experience now. Some of them, the first time I saw a snake bite in Udut, the snake bit the girl right inside the mother's room because it wasn't tiled on the eyes. The child survived quite okay, but imagine somebody in the villages, the floor is not hard, and the snake bit the girl right inside the mother's heart. So the level of poverty is so bad. This is somebody that has not eaten for almost a day or two that will bring a child to the hospital. And another issue is that, unfortunately, it's like, I'm sorry I'm going to say this, but it's the truth. Whereas in the south, you have somebody just having 2 or 3 children, they can manage. In fact, up to now, I have a nephew who refused to have the 3rd child. I said, have this child, I will take care of it. He's doing well. He's a doctor, he has his own clinic. He said he's okay with 2. Now you have a man who doesn't have a work, has four wives with 20 children. 20. The wives don't have, they are not working. 20 children. So if one develop cancer, are you sure they want to come to the hospital? They don't want to come. And then they now put that pressure on you. you see it as if, what can I do? But the people you are thinking out, in fact, as at the time you're looking at that child, is planning to marry another wife. You understand that? So don't get it. If you the way you're if you, way you're going through, if you go all this way, you can get depressed.
Because you're already sounding.
Yes.
You're already sounding.
You understand? You understand the setting now?
Yes, sorry, sir. I want to ask. So, treating a child with maybe a tumor or let's say cancer, which is most of them get cancer down from the brain to the spine or whatever,
All part of the
all
body.
part of the body. Treating
Apart from
that
the
a child with that, there's currently a child we are treating, and he has to go undergo. He has gone his 35 days of radiation. He has the tumor did not come down, so he has to undergo. He has to be resimulated.
another circle.
So
Yeah.
I'm like, is this not more? It's exposing the child the more. I feel like it's exposing the child the more to radiations, and it's getting worse. The way I see.
Okay. Let's realize this. There can be misdiagnosis. Some cancers don't respond to radiotherapy. These have been documented, totally documented. Maybe it's misdiagnosis. We have
Sorry, please, for the sake of people looking at us that will not understand this big terminology, can you break it down? What are the signs of cancer? How will you know a child is having a cancer or something?
one key sign of cancer is unusual growth anywhere in the body.
Tumors.
Growth. If I say tumor, people don't know. Unusual growth,
Some might not even understand the
just swelling, okay, and it's growing. That's one of the key. In fact, it's the key symptom of cancer,
So
either
if
in
you
the
see
abdomen.
something that is swelling anywhere,
Anywhere in the
swelling
body.
on the eye,
Or
on the head,
the
at
you
the
see,
back.
The only part of the body that doesn't develop cancer at all is the heart muscle, and people are still working. Why is it that heart doesn't develop muscle? That doesn't develop cancer. Only the heart muscle don't develop cancer in the whole of the body. Every other body part can develop cancer. You understand? So once you see unusual swelling in any part of the body, or you see a white, something like a white, um, opaque white inside the eyes, that may mean retinoblastoma. But people just look at it and ignore until you understand what I'm trying to say now. Exactly. So the point that somebody has 20 children, doesn't can't even take care of two, and he has 20, and the wife also don't have any work. So if one or two has issue, it doesn't bother him.
I mean, we can take children apart from the small one or cancer test, like
No. There's
for
nothing like no.
prevention.
We don't
No, I
see.
don't think
Don't
there's
even go there,
anything
please. I beg in the name
like
of God.
cancer test.
Nobody prays for cancer.
Yeah.
But when you notice any of these things,
Just
there's nothing like cancer
Check
test.
your word.
Really, at least for us.
Yes.
If when we finish battling malaria, we can start thinking like that. Even malaria, have not finished battling with it.
Malaria, we are not done.
You understand? So the major problem is delayed presentation and negligence on the part of the parents. You understand? And if you don't see from that perspective, you kill yourself. Now, I think this morning I was looking at a statistics. I'm sorry, I'm going to say this. I don't know how safe it is. Kebbi State's internal generated revenue is around, I think in 2025 was around 11 billion. And out of that 11 billion, they devoted 7 billion for Hajj.
Wow. This is bad.
Out of 11, 7 billion. Go and check it. And it's been like that. Most of the northern states, they put so much chunk. They want somebody to go for Hajj when the person is not doing well. You understand? So if this 7 billion for Hajj just every year, if they put that on education, health,
Hell.
we won't have issue. But they want to go to heaven without living well on their hearts. So when you see such a thing, why would you want to give almanjiri on the road, sadaka? The government in the north don't do anything apart from
It's
That's unfortunate.
the NGOs
All right,
that
can you
take
have
care
a
of
question?
them
Yeah.
here.
it's on.
If breastfeeding does not affect the overall functioning of a child, and we see a situation whereby a child's neck doesn't stand until 6 month plus doesn't sit until, let's say, 8 months, and also didn't have teeth until like a year plus, what could be the cause?
Okay. Let me start from the issue of teeth. We don't get worried if a child doesn't have teeth until they are 13 months. 13. So you see a child by 4 months, the teeth are there, and some of them don't have it until 30. It's, like I said, everything in life is in a range.
Yeah.
Okay, I told you earlier on, a child may not control neck until 4 months, but once it's not controlled at 3 months, that's the time to quickly see a doctor to find out if there's any problem. Okay, even sitting, like I said, some children don't sit, they just lie on their back. Before you know it, they start crawling, and then they start holding something and start walking. So the other ones, the most important indicator of red flag is that neck control. If a child doesn't control neck until 6 months, definitely the child may have neurologic problem. Definitely. Okay. So the issue of teething, like I said, is a range. We only get worried if by 13th month the child has not brought out any teeth. It could be that the child is lacking some elements like calcium. We would run tests, confirm, and some people it could be just be familiar. In their house, in their family, they don't bring out teeth until late. Like I said, we are like this. You understand? So those are things we look at. But we don't want you to come seeing us at 13 months when the child's neck is still not
Too late.
standing. Okay? Once 3 months lapse, 4 months, nothing, you should be seeing a doctor around that time.
All right.
Thank
We are
you.
going to the end of the show. There is a
I'm not
question.
sorry, I'm not
Okay.
So you said neurologic problem, like what?
okay, there is something we call cerebral palsy. Cerebral palsy has to do with abnormality of gait and posture due to injury at birth. Why we always want mothers not to do, even the ones that deliver in the hospital, they could have that problem. But when you deliver at home, a lot of people enjoy delivering at home. I don't know why. That delivery, that 15-30 minutes is a matter of life and death. Once there is bleeding at home and it's postpartum bleeding, before you get to the hospital, everything is finished. Delivering at in the hospital saves a lot of children, because if a child is delivered, you have to go through almost a whole day laboring. That process starves the baby's brain of oxygen. By the time the child comes out, the brain is already burnt. You understand? So these are things that could cause some of those problems. We always plead with parents, even if it happens in the night. Nobody is developed labor immediately. You'll have started seeing signs. Some of them will come and tell, because it starts 3 a.m., you can't come to the hospital, it's a joke. Oh. You'll have started seeing signs. And these are things that people do at times that cause, and when that cerebral palsy happens, that's the end. Really unfortunate.
So I am happy that you're talking about CP here. Please, can you just tell us something about prolonged labor? Because here I have seen people say I have labored for 48 hours, 72 hours, and I'm like, what are you waiting for? Like, couldn't you have just done a CS and saved this child? You know, at the end of the day, baby is gone. They are even trying to save the mother. So I am happy that we have touched that part. Please, maybe you can just put in
Okay.
a word.
Now I
Prolonged
believe
labor.
God can do all things. I believe that. I say it. He's done a lot of things in my life. Okay. Once you have had if you are a first timer, you shouldn't labor more than 12 hours. Once it's more than 12 hours, even if you can go on without pain, the child may not come out okay. And why carry the baby for 9 months, survive 30 or 1 hour after the 12 hours, 30 or 1 hour minute of delivery, only for you to have a deficient or um, brain damaged baby? People, once they talk surgery, of course, nobody wants knife. But if that will keep you and the baby alive, you see your baby can smile at you 6 months, but you have a baby of 5 years, cannot sit, cannot stand, and you keep looking at the baby. It's like, what do we gain? So if you have had a baby before, your labor shouldn't be more than 6-8 hours. But if you're first timer, that's why we say all first timer should have hospital delivery. You don't need to. People talk about, I want to deliver like Hebrew women. Are you Hebrew? You understand? Yes, I believe faith. If your faith is strong, you can carry. It's okay. But when this wahala starts, it's unnecessary. It's unnecessary. Okay, so prolonged labor is one of the key causes of brain damage in children, and it's very, very. It's appalling. It's annoying. You understand? Thank you.
Thank you very much, Prof. I have a question here, and said if a child has a swelling on the neck and they take the child to the hospital and the doctor says it is normal, what can we do?
Well, it depends on which type of neck swelling. Some children may have goiter. It's not common, but it could be there. Okay,
Okay,
now we talk about moms. These
moms. Okay.
moms, um, is nothing to worry about. Okay, but when the child has this swelling, people look for this wasp house and put all those things. They don't work. But when the child has swelling outside around the neck, you want to look inside the mouth. At times, when we are young, if you have a wound on your leg, you have this swelling at your,
Yes.
yeah, that's regional body reaction. It's normal, and that's what you are saying there. If there is an infection in the throat, it could swell out in the neck. But that neck swelling also could mean something more serious. Some months back, we've had a lot of children dying from diphtheria. You could also give what you call bull neck. The neck is just big, and this time you look at the throat, you see a white patch. It's a danger sign. But what you talk about is mumps. It doesn't mean anything. Once the doctor looks at it, just give paracetamol because of fever or pain. Within 3 to 5 days, it clears. But if that swelling continues for more than a week, then there is a problem.
Wow.
All
Thank you,
right, we
Prof.
have been enjoying
Okay.
the show, and I would like us to give Prof a round of applause at this junction.
Thank you very
But
much.
we want to close the show with this question, sir. It's about hygiene and home care. What are the hygiene practices for parents to take care of their children to protect them from infections? That's number one. And the second question is, there's this thing that they say when you born a child or when a child is having rashes or something, use antiseptic like Dettol or Tetimoso, something like that. And some will say if you use it much, it's have side effects. So are antiseptics and strong disinfectants, are they safe to use around babies? And when is there a red flag or to look out for a red flag?
In actual fact, let me start from the antiseptic. Antiseptics doesn't have any place in babies. You don't need them. You just need normal toilet soap. They don't need medicated soap. It's too harsh for them. And you see, the skin you're seeing has their own normal flora that protects. So when you use antiseptic, you disrupt that flora, and a more dangerous pathogens can now colonize. So, as pediatricians, we don't advise to use medicated soap. Even the towel in water is not advisable.
Oh,
It's not necessary at all.
stop that.
When it comes to hygiene, is keeping the environment clean. That's the most important thing. Keeping the environment clean. And when your child has messed, you don't leave that. You see a mother carrying a child that's messed the diaper for 3 4 hours. For what? Once the child has messed, clean the child up. Make sure the environment where the child plays is clean. Just clean, that's all. Okay? And of course, the normal hygiene of in the morning,
To protect
bathe
from
them,
infections.
make sure you bathe them, make sure there are no, and we didn't talk about home accidents. Home accidents do happen. And one of the commonest cause of home accident is drug poisoning. During this season, as the heat gets worse, we have people, thank God kerosene is more expensive now, people don't use it again. You see people
Everyone
putting
using gas.
kerosene inside coke or bottled water, and the
Ah.
child is thirsty. Yes,
Kerosene, why?
kerosene inside
Because of what?
bottle
Why is
or
that?
coke. Because they just buy small, they want to use. And we've had a lot of children
To drink?
drinking kerosene. No,
Okay, to use for
to
their
use for
own
their
use.
exactly.
Okay.
And then the child is thirsty during this hot
I
season,
think it's water.
and we've lost a lot of children with that. So that one, thank God,
Some
is
kerosene
even
are
more
very
expensive
white.
now. So
Sure.
it's no more seen commonly. But what I will employ our mothers is every drug should be kept out of reach of children, and that includes the fridge. If you have very young ones at home, don't keep drugs in the fridge.
Okay.
Poisoning can only be managed. Usually, you don't cure them. Most of the time, we lose them. You have an adult packing sleeping pills, antihypertensive, anti-diabetic in the fridge. Even some of the liquids that may be poisonous, antibiotics, they just drink everything and then there is problem. All drugs, perfume, all drugs should be kept out of the reach of children, no matter how. Even paracetamol, okay, a child can go there, is sweet, just drink everything, the liver is in trouble, the kidney is in trouble. So all drugs should be kept outside the reach. If you have to put them in the fridge, make sure it's lockable so that these children are not exposed, because it's only God that protects children. It can be really, things we see can be scary and they are preventable. Thank you.
All right, thank you, sir. Dr. Glory, do you have anything to for us to
Don't
cap?
have any question.
All right, thank you so much, everybody. Thanks
Thank
for coming
you.
to this show. This is New Dawn TV International, and as I've said earlier on, is a media company. We have services, we have photography, videography for your events, or corporate or seminars or something like that. And this particular place we are, this space, it's available for rent. If you have a meeting, you have a get together of people with low numbers, like 20, 25 people. Is here. We have a AC is on for you. We have the gadgets, and there is a guest house here as well outside this place where it's actually a fatty get out. It's not the one that you do sharp corner. So if you need a serene environment to relax as women, because sincerely we don't used to have time to rest. I'm also even thinking about one. If I can see where to put my child, I will just go and lock myself somewhere and rest. So if you need a space like that to have a retreat, to communicate with God, or to even just relax and sleep, even though it's 6 hours, sleep, lock yourself, watch Netflix, take snacks. This place is there for you, PJ Scott, and it's very affordable. There is light. I can assure you, 24/7
Yeah.
there is light. So we have the facilities. And if you don't need these services and you have somebody that needs services, please refer them to us. You have somebody that wants to do wedding and they need media people, refer them to us. People that want to do corporate events, they want to do seminar, they want to do some training, and they need a studio. Please do refer them to us. That would be a best gift you can give us. Thank you so much. Hope you enjoy yourself.
Thank
Are
you.
you sure? How
Had a
sure
good
are
time.
you?
Very
All right. So
sure.
what do we say to our speaker?
Thank you, bro.
Can we
Thank you
say it
for
like
having
we
me.
mean it?
Thank you
Thank
for
you
having
so
me.
much.
I'm
And
grateful.
I know we cannot thank you enough. And the labor that you have been doing in the children ministry, I say
In
it
a
as
place like
a,
Sokoto,
as a
it's
ministry.
tough.
The Lord will reward you and
Amen.
even reward your children and your
Amen.
family as well. Thank you so much.
Amen.
Hope
Thank you so
when we
much.
call you next time,
Uh,
we are going
Prof.
to
I'm
have
available.
you.
Thank
All right,
you.
thank
you,
you. So,
Prof.
All
so
right.
please, we are going to have a group picture with our guest speaker, and we close the show. If you want to meet a friend, you can network, talk about your business and all that outside the show. All right, so media,